welcome to the My Status Quo podcast. I'm Michele High.
And I'm co-host Donna Felter.
And today we're here with Erin Sharpe, the lead clinical navigator at PAM Rehabilitation Hospital. Welcome, Erin.
Good morning, ladies. Thank you for having me.
It's a pleasure to have you on. Please give us some background about you and PAM Rehab Hospital.
I'm the lead clinical navigator at PAM Health Rehabilitation Hospital in Delaware. I am actually a physical therapy assistant as well. That's where I started. And now I got the opportunity to work with PAM at their amazing acute rehabs across Delaware.
They are amazing. Everybody that I've come across in my work who has gone to PAM has raved about it. And I continue to refer PAM and tell people to pre-register. Yeah, you're welcome.
Thank you.
You have a very broad healthcare background.
I do. As a physical therapy assistant, I've worked at skilled nursing facilities. I worked in outpatient. I did home health for 12 years. So I've kind of seen all this. And I was super excited when PAM opened in Delaware because they haven't always been here. I had heard about it. And then I've heard about the services and I thought, oh my gosh, this is great. I wish I had known about it when I was in the other settings that I was in, because I would have referred a lot more. I didn't understand what PAM was, how to get patients in, what it all meant. And now I'm going to get to offer these resources to the community and get patients in and give them good care.
Oh, wow. I didn't know they were in other places either. Huh?
Yeah, we have 84 across the country.
Wow. Okay.
Yeah,
I know. It is, and we're lucky to have 3 here in Delaware. So yeah, we're pretty proud of ourselves.
Yeah, that's great.
What type of rehab do you offer?
It's acute rehab. So it's a little different than your average skilled nursing facility rehab or outpatient rehabilitation. It's short-term rehab. So our average length of stay is about 9 days, but we say that we're up to 21 days, depending on, your diagnosis and what is going on. So acute rehab is different from other rehabs in the fact that it's short term. It's a lot of therapy, which is wonderful. So it's 3 hours of therapy, 5 days a week, which can sound a little scary if you feel like you're sick or you're injured, but it's little bits throughout the day. So you might get up in the morning and do some occupational therapy, learning how to get in and out of bed, in and out of a shower, get dressed, especially if you've had some kind of injury, especially a hip fracture. Getting dressed can be a daunting experience. So to be able to figure out how to do that successfully is really important. So that's occupational therapy. You're going to take a little break. Then maybe in the afternoon, you do a little physical therapy, working on maybe using a new walker, maybe using a cane, getting in and out of the house if you have steps, things like that. Maybe take a little break, and then you're going to get some speech therapy if you need it. Everybody's a little different with what their criteria is and what therapy services that they need, but our speech therapy can do anything from cognitive services to swallowing, eating, voice control, enunciation, volume. They do a lot of really cool stuff in our speech therapy programs. We also have pulmonary therapy, so the COPD, or if you're having trouble breathing, we have respiratory therapy on site that can help you with that as well. We get a lot of people that are new to oxygen, so we're able to provide those services as well. Because that can be quite different too now that you have oxygen on. How to figure out how to negotiate the tubing, how to pace yourself so that you're not getting winded. All those things are taken into consideration when we see you in our rehab. So that's kind of some of the differences of what we have for acute rehab and what makes our services so special.
There's a lot going on where I don't think any other rehab does what you folks are doing.
They really don't. We also really pay attention to the community and what programs we see the community needs. So we have a big dialysis program right now at all of our buildings. So we offer HD dialysis at all of our buildings and PD dialysis in our Milford, Sussex location. So that means if someone has dialysis in the community and they need to get dialysis while they're in our services, we don't send you out for the day. Most rehabs, you're going to get on a bus or get transportation to go get your dialysis and then come back. That can make your day really long if you're already tired, sick, in need of therapy, in need of nursing care. That can really coincide with some of your therapy services, and also makes for a really long day for you if you're already not feeling well. So we're able to provide those services in-house while maintaining your therapy services and your nursing care and your doctor care. You get really great therapy while you're there. So you're going to have that dialysis nurse that's with you all day, providing wonderful education. And we're really proud to be able to offer those services as well. We have a So we saw a need for those services here with our community. People kind of in the limbo of getting a new prosthetic or maybe have an old prosthetic that doesn't fit, not sure where to go, how to get a new one, if you qualify for a new one. Lots of times you kind of get in a gray area where have had surgery, you're out of the hospital, the doctor has done their part, the hospital has done their part, and who bridges the gap between getting you your prosthesis and then getting you training? So we bridge that gap to be able to get you services, take you through the whole gamut. Here's how you take care of your wound. Here's how to get a new prosthetic. Here's how long it will take. Let's do some compensatory and some training before you get the prosthesis to make sure that you are able to be strong enough to handle the prosthesis when you get it. Then when you get the prosthesis, we do that training as well. So it's a really great services to combine all that together to give you great care.
Yeah. Oh, wow.
You had mentioned the 3 hours of therapy per day.
Yes.
Is that a solid 1 hour, 3 times a day? Or is it, as you mentioned earlier, it sounded like you broke it up a little bit. So maybe it's not a solid hour 3 times a day.
Yes.
I'm thinking of the patient who's physically exhausted, and the the concept of
Mhm.
working out for an hour would be more than maybe they could handle even mentally, just in that direction, so that you take that into consideration and
Well,
basically work with them as long as they can and try and work up to that hour.
I mean, every patient's different. That's a really great question. And I think that sometimes that's actually what scares people off from our services because they think, oh my gosh, 3 hours of therapy, like, and even me, I consider myself a healthy woman of a certain age. And I thought before I got to PAM, I can't do 3 hours of therapy. Like, who can do 3 hours of therapy when they're not feeling good or they've had a stroke or, something's going on? So we do pace it for each individual patient. So maybe
Okay.
do a little bit here and there. Maybe today you're feeling a little bit better, so you can do a little bit more therapy. Maybe tomorrow you're not feeling as good, so we give you more rest breaks, or we break it up to 7 days this week versus 5 days this week. So we break it up to each individual depending on where you are in your therapy journey. I'm
Okay.
surprised. I've always been surprised at the people that come in that I think, oh my gosh, right now they need two people just to get out of bed. How are
Right.
they going to do 3 hours of therapy and be able to go home? But again, because we pace our therapy and because we're giving individual care, all of our care, Miss Donna, is between you and your therapist. So you're going to see your therapist one on one for your entire session every day that you're there. You're not going to sit in a group setting. So that therapist is going to be able to say, "Oh, you know what? It looks like you need a little bit of a break. Let's take a minute. We'll go over some safety techniques. We'll go over what it's going to look like when you go home. Okay, feeling a little bit better. Let's go take a walk now." So we really are trying to pay attention to each individual care, each individual patient. And because we are doing that, that's why we're so successful.
Okay.
And my understanding too is part of the 3 hours is when they are getting dressed, if
Oh,
that's,
100%.
yeah. Yeah. So
Yeah.
it's
So,
part of ADLs, their activities of daily living are included in that. So I don't know. It's not 3 hours of just, working out and
no,
right. Okay.
exactly right. It's not like we sit you on a treadmill for 3 hours and say, go.
Mm-hmm.
So part of that is being able to get dressed, being able to get on and off a toilet, in and out of a shower, eating, being able to get in and out of a refrigerator, make food. We also really pride ourselves on our family and caregiver training. So we want to make sure that whoever you're going home with or however you're going home, whether that be with a caregiver or a daughter, a wife, a aunt, an uncle, that they're coming in for training as well so that everyone's on the same page and we're going to set you up for success. So we're going to have everyone in and say, okay, here's how to get in and out of a car successfully. Here's how it looks like to get in and out of the shower, in and out of bed. Here's some really great training and some information on to get up and down your steps. So that's all part of your therapy. So I hope that makes sense, that it doesn't seem as scary. Like I said, that you're going to be on a treadmill for 3 hours. We're looking at you as a whole person and figuring out what's best for you to go home with your family.
That's great. Is there an area that the family can wait for
Yes,
their
so each
loved one? If it's, I mean, I assume most of the patients go home daily, or no? You have facility there for them to stay longer overnight,
they
or
stay with
how
us
does that work?
overnight. We have inpatient where they
Okay.
stay with us overnight. And then we also have
Okay.
outpatient where you would come in a couple times a week,
Oh,
specifically
you
for our
do? Okay.
inpatient program. Specifically for our inpatient program, all of our rooms are private rooms, which I love. Especially like I said, being out in different settings and different, if hospital, we are coming from home. I don't know about you, but when I'm sick or don't feel well, I don't like to share a room with or with anybody. I don't even want to see my
Right.
family. Let me go. So this is really nice to have your own room, your own bathroom. Your family can come in and see you or not see you. Um, have, your own private setting so that you can take a break, you can watch a movie, you can sleep. Your family can come in. If your family chair that folds out to a bed, so they can come stay. Some of the hospitals that surround our buildings have also given a discount if for some reason you're out of town or your family wants to stay closer to you as well. They can kind of go between us and the hotel. So we do try to make it kind of like your own little personal hotel room, and give you that quality time to be able to see your family. Your family can hang out there. All of our cafeteria drinks, coffee, tea is all complimentary. So your family is welcome to hang out in the cafe. Our meals are fantastic. They're very low cost and you get a big portion. So if you want to come eat for the day, you're welcome to stay. And we're really proud again to be able to offer that kind of convenience, and kind of more of a home setting, to your family and your friends. And dietary team does a great job, patient to patient, to see what your likes are, what your dislikes are. Do you have any food allergies? What's your dietary restrictions right now? And how can we make that work for you so that you're happy and feel a little more cared for? Nobody wants to not to feel like they're also being nourished and happy with their care while they're not feeling well. So our dietitians are
Yeah.
really strict and really caring in that way as well. I'd say that we hired the right people. Their love language is food. So
Mm.
I'll give you an example. One of our patients really loved Pepsi, and we are Coke providers, and
Well,
she
that's
wanted
smart.
Pepsi. Right? And if you know, you know. It's either one or the other. You are
Yeah.
a Coke girl or a Pepsi girl.
That's
So,
true.
right, our staff went out and bought her Pepsi so that she could have Pepsi because that's all she
Oh,
wanted while she was there.
oh, that's
So
nice.
we are trying to make those little differences so that you do get better and you feel comfortable while you're there.
Okay. So, what disqualifies someone from being able to um, use your services?
That's a great question. There's lots of qualifications. So I'll say that to get referred to PAM, it's usually three different ways. Most people come to us from a hospital. So if you're in a hospital and they say you need rehab, or you're in the hospital and you feel like you need rehab, you come to us from the hospital. That being said, we do not need a 3-night stay and we do not need a physician referral to get to us. So lots of rehabs, you need to stay in the hospital for a certain amount of time in order to be able to go to rehab. You don't need that for our care. So let's say you go to the ER home and you feel like, oh, this isn't going well. I really need rehabilitation. I'm not feeling well. I need medical care. We can take you. So you don't need that 3-night hospital qualifying stay. People normally
Okay.
get to us is from their physician. Maybe you have been in and out of the ER, or you're not feeling well, or you're having some exacerbation of conditions. You might go to the doctor, and the doctor will say, yeah, you really probably need to go to rehab. So we have a lot of physicians in the community that call us as well with their referrals. The third way, it's kind of like key to my heart because I did home health for so long, is home health recommends for us, or you can make a self referral. So home health will say, Mrs. Smith, we've done all the rehab that we can do. we are kind of limited right now. We'd love her to come to rehab and really get that extra oomph in her care. Or Mr. Jones is not doing well with services with home health. It just doesn't seem to be enough. We bring him into rehab. Or we have a lot of patients that say, for example, I'm on dialysis, I've gotten COVID or I've fallen and I'm just not doing well. I can't get to dialysis. I'm not feeling well. I need medical care and rehab. And we bring them in straight from home. That you
Oh,
can be referred to our services, which I think is so unique and dynamic, and to treat a variety of patients and really, like I said, bridge those people that need service and care.
great. How about insurance? What's accepted, what's not accepted?
Oh my gosh, what a loaded question. Right? Don't we love insurance?
Ah,
Listen, I'm trying not to get on a soapbox, because I've had these conversations with my family members as well. So insurance is tough. And right now, insurance kind of rules the world, right? So insurance is making decisions for your care every day. And that might be good things that you want and bad things that you want. So I tell everyone to be their own advocate. I know that you preach that as well on your podcast and in our community education, Michelle, that
yeah.
you really need to be your own advocate and know what your insurance will offer and what you can ask for, because the insurance company might not tell you what services you're eligible for unless you ask. So Medicare is an easy referral to come to us. We do not need a pre-authorization for Medicare. That's the easy one. So if you can keep your Medicare, that's the red, white, and blue card that you get,
Mm-hmm.
please keep it.
Yeah.
I know sometimes it seems like some of the other insurances are better or different, or they're offering you free $40 to go to the gym or free money to go spend at your CVS pharmacy. But when you really need care, Medicare is like the gold standard. They're going to be able to get the Advantage plans, which some people are getting through their retirement or switching out of Medicare to go to an Advantage plan. And by that, I mean like a Cigna Medicare, an Aetna Medicare, a Humana. You do need a pre-authorization for. That does get a little trickier and a little more. That's the game that they play. We do all of our due diligence for you. So you would say, for example, I have United Healthcare Medicare. We go through your records and get your uh, evaluations for physical therapy, occupational therapy, get your records from your physicians, from the hospital, from home health, all with your approval. And then we're going to fight for the insurance company to approve you for our care. Let's say that they deny, because they're usually deny the first authorization process. We then have a whole corporate team that does what we call an expedited appeal. And we're about 70% successful with our expedited appeal process. So if for some reason you're at home or in the hospital or with home health, we do all this for you. You just basically have to say, I want to come to acute rehab, and we will take the onus off of you in the hospital and the doctor's office, getting those appeals and making those authorization requests. I will say just a little caveat to the insurance piece that I wish more people knew, so I'm happy to have this platform to talk about it, is if you have an Advantage plan, they deny you, they never have to tell anybody that they denied you. So those metrics and those numbers, no one ever sees. They don't have to report it to CMS. They don't have to report it to their stakeholders. The expedited appeal process is where they have to show those numbers. So it's behooves them and behooves you to go through the expedited appeal process, because they don't want people to know how many people they're actually denying. So if you don't fight for your care, no one ever knows that they denied you. So we like to go through that appeal process so that they have to own up to the denials that they're doing, so that CMS and the other insurance processes know how many people they're actually denying. Again, we're successful with our expedited appeal process because they don't want people to know what they deny. So they're most likely to try to approve you on that side. But if you don't go through that appeal process, no one ever knows besides you and them that you were denied. So I say appeal, appeal, appeal. And make sure you're fighting for your care and asking for what you want. It's really important to advocate for yourself in this healthcare climate.
Wow, that sounds like a whole nother podcast.
Oh, yes, if you wanna do another one, we can talk about that for hours.
Oh my gosh. Yeah, I'm hearing that from a
Yeah,
lot of different sources right now. That's terrible. Glad
Aaron,
that
what?
you're helping people get through that. Jeez.
yeah,
Yeah, that's a major project, just trying to
Hmm.
navigate
it is.
health insurance
And imagine
and
being
getting approval.
yeah, imagine being sick and injured. I had one
Right.
gentleman, his sweet wife, they were in their 90s. She had had a stroke. It was like the day before Christmas, and he's on the phone to the insurance company crying that he's been paying into the insurance his whole life. How come she can't get care?
Mm,
So
Oh,
sad.
yeah.
So yeah, and he, he
Yes.
had to be her advocate. So thank goodness he was
Right.
being her advocate to, try to appeal and get different medications and get different resources and get different rehabilitations. But if he wasn't her advocate, she would have just gone wherever the insurance company said. And if you don't ask, they're not usually at liberty to provide you with resources.
Oh my gosh.
that's awful.
Yeah.
Now,
So we're happy to
I'm
provide
assu-
that information.
I'm assuming if someone is denied, however, you would
Yeah.
still accept them. Private pay is also an option.
It is. Private pay is an option.
Okay.
So we go through each case by case and let you know the cost. Everybody's a little different depending on your diagnosis, but there is a private pay option as well. And I always say, so if you look at rehabilitation and care in general, you want to try to get the most care and the best care. We are the most acute resources and we're the highest level of rehabilitation you can get. So, if for some reason we can't accept you for whatever reason, or your insurance company denies you, or you're not quite ready, or something is going on, we will refer you in a different direction. So we really do our due diligence and want to be your resource for care in general. So sometimes our care isn't for everyone, or sometimes they want to go in a different direction, or sometimes they're not eligible, or their insurance company denies them. We try to work with you and say, okay, this isn't a possibility now. Here's some other options. And if it doesn't work out now, here's how to get to us in the future. Or here's a phone call to call for other resources. So we are happy to be able to just provide a resource. We have navigators in all the hospitals in the area. So there is a navigator there daily. So if for some reason you're in the hospital, whether it be in the ER or upstairs in a bed, if you are not sure of what services work for you, or you just want to see if PAM works for you, ask for the PAM navigator. They will come up and speak with you. And again, if we can't help you, we're happy to point you in a different direction and let you know of other resources. So we're happy to just be a support system in general.
Oh, that's awesome.
It is. There's so
Yeah,
few
because
answers for people that are in the hospital setting. They have so many questions, and we all can get on our
Mhm.
iPhones and ask Google or chat, but it really doesn't bring you to the general area that you live in for the real definitive answers that people need. So that's huge that you take your time with people. Yeah.
Yeah, and the hospital systems are busy. The physician's offices are busy. Not that we're not busy,
Right.
but we're just happy to be able to provide that extra support to, like I said, bridge some of those gaps and bridge some of those gray areas that we're seeing out in the community. Our healthcare system is an overwhelmed system right now, especially down here in Delaware. We are they call a rural healthcare system.
Oh, wow.
So, healthcare in general is short providers and short resources,
Yeah.
and we are no exception to the rule. So, for us to be able to take a little extra time and kind of review some information and give you some support and resources, it's our pleasure.
So
Hmm.
nice.
Yes. So nice.
Yeah,
And to be able to have conversations like this and go out in the community,
yes.
Michelle, that we do. It's
Yeah.
really important to be able to have people be proactive in their care, to know their
Mhm.
resources before they need it. That's kind of our goal.
And like I've heard you mention before, the human connection, it's essential.
It is essential. I think, like you said, it's sometimes, we're tied to our phones and tied to a computer, but you don't really know what you don't know, even from a computer. It's a different conversation. And to
Right.
be able to look someone in the eye and say, oh, here's your family. What do you need? You're not going to get that from a computer. You're not going to get that from looking up something online. So we're happy to, be the face of resources in general.
Can you discuss about the training that you and perhaps the professionals at PAM receive that go beyond strictly the medical care that they receive?
Yeah, so all of our navigators are either physical therapists, physical occupational therapy, or nurses. So they have their own unique perspective on healthcare, and have worked in a variety of settings. So you're getting a clinical person that is seeing you and reviewing your chart, to make sure that you're getting the care that you need and getting the resources and support and eligible for our services. As far as the training with our staff goes through a lot of different programs. So we're proud to, like Erin Services, we have a really great, like I told you guys, our acute amputee program. We also are big and loud certified. That's also known as LSVT. Have you guys ever heard of that program?
No.
No.
It's fantastic. It's specifically for Parkinson's patients. We've seen a lot of Parkinson's in this area for some reason. So
Okay.
we decided to get some of our therapists certified in this big and loud program. It's specifically, like I said, for a Parkinson's patient. The big part is the physical therapy and occupational therapy part. So it's going to work with you on compensatory techniques such as being able to lift your feet up, being able to make big ranges of motion for better movement, posture control. Those things are essential to a Parkinson's patient. And it's those little Parkinson's not being able to stand up straight, not being able to lift your feet up to use your walker or go over a threshold or get up and down the steps, having to take those small motions. We really try to break up those patterns and be able to let your body move more free and with a greater range of motion. That's that big portion of the big and loud. The loud portion is our speech therapy component. Lots of times with Parkinson's patients, their voice gets softer and you can't hear them as well. They're not able to enunciate their words as well. So we are going to work on the volume, the voice control, being able to enunciate your words better, have a more elongated conversation instead of just one word answers, and being able to have that communication. So it's a two-pronged approach, and we've seen such great success, and we have that program at all of our locations. So we can start you in inpatient and then transition you with our outpatient therapists, or you can start just in our outpatient program and really see that success for that program. Parkinson's is a progressive disease, but doing this program has shown to hold you where you are in your Parkinson's progression for up to 2 years. So
Wow.
imagine going through that program and getting your life for those 2 years.
That's
Yeah,
amazing.
that is.
Yeah,
Wow.
so we're really excited to be able to offer some of those programs to really make the difference in the patients that we see down here. A lot of our nurses are stroke certified or rehab certified. That's a big distinction with our care with our nurses. Our doctors are PMR doctors, and then we also have a variety of specialty services at our buildings. So you'll see a doctor every day, which sets apart our acute rehab from different rehabs. So you might see our PMNR doctor, and then depending on your specific diagnoses and your needs, you might see cardiology, nephrology. You might see a neurologist. You might see our nurse practitioner. One of my patients said the other day, I've seen 4 doctors today. That's more doctors than I've seen all year. She's like, "How many doctors do you have here?" I was like, "Well, you're special today. You get to see everybody and everybody's here." So
Mhm.
we really are trying to provide those services and that care, which again sets our care apart. We also have pharmacy right in the building and on staff. So we're able to change those medications quickly, whether that be pain management or your Lasix if you are filling up with fluid. So that again sets our services apart. The doctor's going to get to know you and say, "Hey, this morning you were looking really great, and this afternoon you're not breathing so good. Let's see what we need to change." At a lot of other care, you're not getting that roundabout and you're not getting that robust services. So you might have to wait for medications. You might have to wait for the doctor. We're able to do all that stuff very quickly to make sure that you're healing properly and safer and more effectively.
Wow.
I know
Well,
That's
I
impressive.
mean, we're doing all
yeah.
the things, right?
Yeah.
Yes.
What are some
We really
achievements
are.
and awards you guys have been given for this?
We are. So out of 84 hospitals in all of PAM, Delaware gets the elite status every year. We've been very lucky in our buildings, but this year we got the gold
Wow.
status, which is they never have
Oh,
had that before in any of the PAMs, and Georgetown and Dover got the gold status. Sussex hasn't been open long enough to get some of those metrics, but that means that we're getting our patients better, faster, stronger, with more resources, getting them back to home. So with all those metrics in place, we're able to provide really extensive care. And our two hospitals here in Delaware out of 84 in the nation are the gold status. Isn't that cool?
wow.
Like how
That is
awesome.
really
That is,
cool.
Like how
congratulations.
great.
That's
Yeah.
actually,
Thank you. Like we're really proud to
that's
be able to
great
have those
news.
services here, especially here in this
It says a
area.
lot about the, yeah. Yeah. It says a lot about the people that work for you, work there.
Yes.
It really does. It really does. Kind of like a little
I mean,
unicorn.
yeah, any organization and any branch of that organization, it's the people. I mean, everywhere we go, people
Yes,
make the difference. Hmm.
people make the difference. And we really are trying to pay attention to our community and see what our community needs so that we can make those differences.
That's amazing. You offer a wonderful program,
Thank
and
you.
it's
We're really
great that
happy
we're
to be
able
able to
to.
offer it. Thank you. And it wasn't always here. Like Dover's been open going on 8 years now.
Okay.
Georgetown is going on year number 4. And Sussex has been open just a little over a year. We were inside the Bay Health Hospital, and now we're standalone on that Milford, Sussex Bay Health campus. So if
Hmm.
you think like in 8 years that we've been able to provide to the community and help the healthcare system here in Delaware, but also some people still don't know about our care. They're moving to the area or they're not used to needing this level of care. We're so excited to be able to offer these services here in Kent and Sussex. We're the only rehabilitations in Kent and Sussex County that are stroke certified, which means CMS and the JCO hospitalization organizations have deemed us that we're the gold standard for stroke care,
Wow.
which is important, especially here. Delaware is now the #1 state for incidence stroke. We used to
Wow.
be number 3, and now we're #1. Not the #1 we're going for, right? Like, let's be known for something else. But
Yes.
unfortunately, with
Interesting.
Not to
healthcare,
like diminish the
yeah,
numbers,
unfortunately with healthcare,
yeah, not to diminish the numbers,
yeah,
but basically because there are so many seniors in such a small space.
exactly, in such a small area. But I'll give you this stat too. So the flight team flies people out for higher levels of care, whether that be to Christiana or to PRMC, to Penn, to Jefferson. They used to fly out once a week. They now fly out 2 people a day.
Oh my goodness.
Uh-huh. So there is a
That's
big need for more services in this area. And again, we're happy to be able to be a provider to bridge that gap. So
Mm.
if for some reason you are out of the area, you can come to our services. If you are flown out for a service, you are able to come back here for your rehab. The town, I had a patient call the other day on a vacation in Virginia with his family and had a stroke. He was at the hospital when the hospital deemed him eligible, came to us for rehab. So we are seeing a lot of people from out of the area, whether they be vacationers that are here, our families on vacation out of town, or being flown to different areas to get care, coming back here to receive these services. And again, we're super proud to be able to offer that in this area and have those specialty certifications to provide wonderful services.
That's
wow.
impressive.
It is. Um,
Thank you.
okay, so before something happens to me, do I
Yes.
come and pre-register so that Pam, like,
That's a great question. I wish it was that easy. And I the more I am in healthcare, I am a firm believer that you never know what's going on with your body, right? You
Hmm.
you might think you know, and the hospital might think you know, and you might have a certain diagnosis, and then something happens. So, what we like to say is know us before you need us, which means know that you can ask for our services at any time, whether that be from your physician, whether that be you call us directly, or you ask the hospital for our care. You're welcome to come for a tour at any time. send your family before you get sick, come take a tour so that you know what it looks like before something would happen. If for some reason you're in the hospital and you want to take a virtual tour or your family wants to come check it out before you come, you're welcome to do that too. But every day we go through our list. We're kind of like a hotel. So people are checking in and checking out every day. So we're going through our list. Okay, we have 5 beds open in Georgetown, 4 beds open in Dover. Who's ready from the hospital? We triage from the hospital first, since they are needing the most care. So we're going through them first and seeing, okay, well, we still have a couple at our physician list and our home list. What happens around 12 o'clock every day is that something happens in the hospital, whether that means that we thought the patient was good and then their blood pressure went a little funny, or they're waiting on an echo or a consult from a specialist. So they're being held for an extra day or extra time. And we start again going through our list of who's at home, who's at a physician's office. So it kind of changes daily and sometimes by the hour. So you can't exactly pre-register, but you could call me and say, I'm in the hospital. Can you be on the lookout for my services and see if you can pull my chart and ask for care? You can call me from home and say, hey, does it look like I'm eligible from home? So you can call us at any time and say, hey, I would like to come to PAM. Am I eligible? Or I have a surgery coming up next week. Can I come take a tour? And then if I'm in the hospital, I can call you and say, can you pull my chart and contact the hospital or tell my caseworker to call you with a referral? So that's usually the best way, is to ask for our care at any time and we can see where you are in the system and in the process to get you in.
Okay.
But again, sometimes if you're not asking for care, you don't, people don't know, or they're, trying to go a different direction. We need you to have a medical need and a therapy need. That's all services. The medical needs can be a variety of medical needs, and the therapy services can be a variety of different therapy services. So if for some reason you just even have a question, if you're qualified, let us know. Let us be the guides for you. If you're not eligible for our services, we will send you in a different direction and get you a different resource or support. But always ask the question, because it's worth the conversation. Now, some people, I will say, want to come to a specific hospital, like they might live closer to Dover or they might live closer to Georgetown. I always say you're here with us for a good time, not for a long time. So if for some reason we have a bed available in Georgetown, but you live closer to Dover, it is worth you coming to whatever PAM you can get into, whoever has a bed, because we're going to do that. Great services. Your family can come in and visit whenever they want. And you're not with our services for long. A 2-week-ish, 3-week-ish is about the length of our stay. So get in when we can get you into a bed and get that good care started, and get on the road to recovery as soon as you can.
And time is of the essence when you're dealing with any type of health issue and trying to get in.
100% time is of the
Right?
essence. Yes.
Yeah.
And I think sometimes people wait too long,
Mm-hmm.
and then something else happens or they're worse off.
Right.
The quicker we can get you to rehab, if for some reason you think you need to call and you just want information, or you think you're eligible, or you just want to know if you're eligible, give us a call at any time. We're happy to review that with you and talk to you. We have patients that are not eligible and waiting to be eligible, whether they need different insurance authorizations or different approvals. I mean, we're happy to walk you through the process and make sure that we're getting the right care you.
Well, you are full of wonderful advice. And
Thank you. I want to give you guys my number if you don't mind.
no,
And
that's
that way people can call me
perfect.
directly.
Okay.
We're also happy to come out with our team, with Michele and some of our other community resources, to speak at any community resources, whether that be a health fair. We speak at a lot of communities, like 55 plus communities or church groups, to let people know about not only our services, but services like Michele's program, or services in the local area, about resources and support you can get before something happens to you. So I'll give you guys my direct number. And if you have any PAM questions, I'm happy to help. I'm Erin Sharpe. I'm at PAM Rehab, and
Oh,
my
great.
number
Thanks,
is
Erin.
302. Yeah, 302 382 2383.
Thank you for that bit of information.
Yes, I feel very passionate. You know, my family lives down here too. So I want to make sure they're getting good care and make sure they're getting good resources too, right? So only for the
Absolutely.
community, but for my family as well. So we all have to help each other.
Yes.
Agreed.
Group effort.
That's great. Do you have anything else to add, Erin?
I was going to say we can take it from any setting. If for some reason someone has recommended you go to rehab, you've gone home, or you've gone and you're not happy in it, like a skilled nursing facility or some to PAM, we can get you again from any setting. Or if you feel like you've been in and out of the ER, you're at home and you're not doing well, maybe you used to be able to get out of bed and now you've gotten COVID and you can't get out of bed, or you're having some CHF exacerbations or Parkinson's exacerbations, we can help you. So from home, from a doctor's office, from the hospital, we are here for you to help you get care, get services. I mean, we're lucky to have each other with resources down here and be able to have our own support system. So if I don't know, I can call you or call anybody on our program or in the community that I've been a pleasure to work with and meet with and say, okay, I can't help, but hey, here's somebody from Easter Seals that can help. Or here's this awesome service that Michele offers. So you know, we're happy to be able to services not only for PAM but for everyone else. And it is a community effort. So yeah, it's fantastic. You know, community down here is big in Sussex and Kent County, and it's been great to be able to meet people and offer great care.
All right. Thank you, everybody, for joining us, and we'll see you next time on the My Status Quo podcast. This podcast was brought to you by the My Status Quo Home Catalog.